we'll open it up for question and answers. So I'm going to go ahead and hand that over to Jay, and then we'll go ahead and go with Dr. Gupta. I gave you co-host capabilities as well.
All right, thanks, Elizabeth. Yeah, just a quick announcement. We just want to, reiterate, we want to use the Echo platform, as a safe space to share opinions, and just kind of a reminder that we're all on the same team here, trying to get the information out and, make it a place where people can share questions and things like that. So we just want to keep that in mind. We try to have that kind of collaborative, atmosphere in all our projects. And so we're kind of making this announcements across all of them, just a kind of reminder that that's what the Echo model is. So, but looking forward to the presentation today. Thank you for doing that, Shipra. We really appreciate it. I know it was last minute, so thank you. Go ahead, Elizabeth.
Awesome. Thank you so much, Jay. All right, Shipra, I gave you those capabilities, and whenever you're ready, you can go ahead and share your screen.
Perfect. Let me try this from, okay. Oh dear, I can never do this right in the first go, but I promise I'm working on it. Here we go. And Dr. Weiss is just laughing away, which is great. Let's see. Now from beginning, let's see. What do you guys see? Do you see my notes too, or just the slides?
I just see the slides.
Okay,
like,
beautiful.
So that's like the next slide that's going to be coming up to the right on my end.
You see, so you see 2 slides?
Yeah, do you guys too?
Yeah.
Yep.
Never mind. We'll try this again then.
It's okay. Go to the bottom where the little next to the zoom in, zoom out on the bottom right.
Uh-huh.
You see that little symbol next to the open book?
Hold on. You guys will have to see my kids, okay? So you have to see my
Oh, that's fine.
There we go. Screen 2, and I think this will work now.
Oh my God.
Yeah, they're.
It's working.
I don't have a lot of things to say about them. So I see Elizabeth has moved to Greece now. She was in Paris last week.
A world traveler. We'll see where I'll be next time.
Okay. My name is Shipra. I'm one of the pediatric infectious disease faculty at WVU. Well, I have a few slides so that we could have a little brief update, and we can cover that, and then we can have some discussion. So looking at this is from the CDC's website, COVID-19 weekly cases per 100,000 patient population. And this was broken up into age groups, which is really neat to see, but it looks really busy. You can see that the numbers for 14 to 17 started going up around between March and May, but still not compared to any of the spike that was in December and January. So that was cool. Overall, all the numbers are coming down. Like you can see the little funnel at the end, and it seems like the light at the end of the tunnel here. This was really cool. When I saw this, this reminded me of the flu map, but also the colors. Like CDC usually just uses color shades of blue and dark blue and a lighter blue, but this was good. So they are defining level of community transmission throughout the state. There are 2 criteria. It's total number of new cases per 100,000 population, and then percentage of positivity by NATs, by the PCR testing. So when I looked at West Virginia, the testing is less than 5. So we should have been blue, but our total number of new cases is still higher. So that's why you can see most of the states are yellow, which goes with moderate transmission risk, and then moderate community transmission. And then there are a few states that are blue, and I thought, okay, my geography is really bad still, so I'm working on it. So the blue were Nebraska, South Dakota, and Vermont up there. And then I don't know what this little island is at the bottom. Anyone? This little island thingy?
Puerto Rico.
Puerto Rico.
Yeah.
Oh, Puerto Rico. That's where my friend went for vacation. Oh, okay, great.
They're doing good. They're doing good.
Dr. Wise, thank you for helping me.
But the thing is, so the reason it's there and not Cuba and all the other ones is because it is a territory of the United States, like you studied on your citizenship
It
exam.
was not part of it wasn't that hard. Okay, we're good now.
So what's the little yellow blob to the right of the United States? You should know what that one is too. It's another territory.
Oh dear God, I see. This is why I don't put maps on here. No, I don't know this yellow state. The big one I know, that's Alaska on the really big triangle thingy. But what's this yellow thing?
Well, I think it's Guam, right? Hawaii, Alaska, Puerto Rico, and Guam.
Okay, yeah.
I thought from the shape it was the District of Columbia.
Ooh.
Hmm.
The website is down there. It should have the name of the state. I'm staying out of this. My kids, Neil will start school soon, and then maybe I will learn the geography way better. But if you can, overall, the cases are going down. I'm hoping soon we will all be in this really nice blue color, especially if once we bring down our total number of new cases. All right, moving on to looking at West Virginia COVID-19 cases. Really looking good there. Not a whole lot of cases. This is a dashboard from yesterday, but really not a whole lot of cases were added on. They have a variant data dashboard too, so we'll look at it real quick. Looking throughout the state, looking good. Again, this is just shades of blue, nothing as shocking as the other one that we just saw. Overall percentage positivity, daily percent positivity yesterday was 1.92. Today it was like point something. So really looking really good there. Looking at the summary for children across the United States, total cumulative number of children who have tested positive for COVID-19, that percentage has been at 14.1. It was 14% 2 or 3 weeks ago when I looked at it. There was a spike in the percentage of children, like the proportion of children who were testing positive for COVID, but that was more because adults were not testing as much positive, so that number has gone down. So there has not been a whole lot of increase in the cumulative number of cases in kids throughout. Mortality remains low, hospitalization rates remain low. Just another graphic representation of the total number of child COVID cases, COVID-19 cases added in the past week. Everything's going in the right direction. A little bit about MISC. So the data is they're still collecting data from all the health departments. So you can see that these numbers are, if you follow this dashboard, you will see that the numbers are increasing, but these are all old cases that they are reporting now. So this is just, again, the states, and this number has stayed pretty much constant. So this is a graphic representation again, but then you can see the MISC spike shown in the dark blue. You can see there has not been any new spikes. It was the big spike following the January infections. That's when we saw the number of MISC cases, but we have not seen anything new since then. This is the variant data from the CDC's website. Looks really fascinating. So as it was predicted, B117, which was originally identified in the UK, is the predominant strain. And then we have some of the P1, which is the Brazilian. 16172 and 1 are pretty, the strains that were identified in India. They are increasing in circulation. So that's something that everyone's super concerned about. And then 1526 and 1525 are also gaining numbers. Looking at West Virginia, so B117 is the most common. This was the only way I could pull it up. So they have a male to female distribution in this graph, but the overall B117 was 2,000 cases. B1351 is 5 cases. P114, B1427, which is the California variant, you have we have 238 cases. Looking at vaccination rates, this is from CDC. So these are our numbers. And then I briefly wanted to touch on myocarditis after mRNA vaccine. The slides I use that I have are from the FDA meeting on biological products that happened on June 10th. So a lot of those slides, but the discussion, and I just used some of the slides that had most of the meat on the discussion. So this was presented by vaccine safety team from CDC, and the link for the presentation. It's a super long 7-hour presentation. I did not watch the whole thing, but it was the 10-15 minutes that was really interesting to watch. So this is from the VAERS data. This is the preliminary data from VAERS, where they have noticed that there are more cases of myocarditis, pericarditis reports, especially after dose 2. So far, they've had about 573 cases after dose 2, and then 216 after dose 1. So these are self-reported or physician-reported or hospital-reported cases. And then they broke it down into characteristics. It seemed like more, the median age was 30 in the patient population that was presenting at dose 1, after dose 1, and were younger if they were presenting after dose 2. They were presenting quicker after dose 2, so within 2 days. And then there was a male predominance noted in both the groups. Looking at the presentation symptoms, chest pain and elevated cardiac enzymes were the most common, and then followed by EKG changes, dyspnea, and then abnormal echo or imaging. So what they did was then they looked at all of these cases and looked at what the outcomes were of these patients. So out of the 475 cases, and they extended the age to less than, like the initial reports were in adolescents, but then they looked at the whole subgroup together, and they saw that 270 were discharged, out of which 91% went home, 3 went to a rehab facility, 21 did not. There is still a lot of unknowns among this group. About 221 did not, but most of them have had full recovery of symptoms, but there's some missing data on ongoing signs and symptoms. So then they looked at they tried to compare it with published literature of what the expected rate of myocarditis is supposed to be in that age group. And you can see how the expected rate in 16 to 17 should have been 2 to 19, and it's 79. So there is definitely an effect from your vaccination, because your observed rate is way higher, especially in the 18 to 24 year group. And then also I thought the 25 to 39 to 124 was pretty significant. Then, so they have a vaccine. So that's the VAERS, which is a self-reported. And then they have a vaccine safety data link, which is a bunch of hospitals that are reporting all of this information. So then they did an additional, so looking at the vaccine safety data link, they tried to come up, they stratified it according to different ages. And then this was the age group that they chose because this was the one that they were really worried about, that this was the group that is getting affected. After the mRNA, so rate per million was calculated by using rate per million doses administered. So after the dose 1, 2.8, dose 2 was 16.1, and comparing the Pfizer and Moderna, it seemed like there was more in the Moderna group, but the thought process was that Moderna has had not so many doses have been used for Moderna, especially in the adolescent age group, so that's why the rate seemed a little higher. So there's definitely more to come. Then they talked about the second dose effect. Like you can see how it almost like goes 10 times or even more for Moderna between the first dose and the second dose. So they talked about that too. So in summary, what they looked at was be safe and where surveillance data was consistent from pre-authorization clinical trials. It does talk about median age of reported patients is younger, median time to onset is shorter, predominance of male, observed reports greater than expected reports. So we looked at that from the published literature. And then about the rate of about 16 cases per million second doses. There is a meeting scheduled on June 18th where they're gonna look, ASIP meeting, to look at all of this again. If you guys have time, you should definitely listen to that. I'm gonna pause here and see if there are questions.
There was a question in saying we're getting a lot of questions about whether there will be a need to be a booster doses of vaccine, and if so, what the timing will be. Do we have any ideas of what that might look like? Thank you so much, Dr. Rector.
I think everyone's been talking about the booster vaccine, and is it gonna be just a boost of the dose, or would it be a second generation, which is going to be a different kind of strain that they would be using? But like, we still don't know. It seems like from the study from the initial study group that had the vaccine, the immunity is pretty long. It's for a long duration, so I would not think it's like a booster, but it might be a different variant strain that they might come. But it also depends on like how well our current vaccines are working against these variants. So there's still a lot of things up in the air about the second booster shot and how much that's gonna hurt, but then it's gonna work.
Thank you so much for that answer. Does anybody have any other questions right now? You can chat them in, use the raise hand, or any comments before she continues with the presentation.
Okay, I guess we're moving on.
So Catherine has, what is the incidence of myocarditis? Is how you say it? I'm sorry.
Myocarditis.
Carditis with COVID.
So we don't know, and that is something that is being studied too, is the cardiac changes that people were seeing, because early on our focus was, especially in the younger adolescent groups, we started seeing those myocardial changes on the echo and cardiac MRI findings. So I don't remember seeing a rate. Dr. Weiss, Dr. Moffat help. But, you know, and that's why, so at that FDA meeting, Dr. Paul Offit asked this question. He said, like, do you think this is similar to something related to the MISC feature? Because if you're causing some kind of inflammation, and that's what we were seeing in MISC too, was myocarditis. And was it the first dose that triggered it, or is it the second dose that is causing it to like go into full blown? So there are lots of things that are being looked at. Yeah, I don't know about the COVID and myocarditis number.
No worries. Thank you so much. If there aren't any other questions, you can go ahead and continue. Thank you.
Okay, totally unrelated to COVID, which we had missed during COVID, was RSV, right? So CDC has put out a health advisory just to notify clinicians, and I wanted everyone to know about this because the southern states are noticing a surge in RSV and severe RSV. We also have had a few RSV patients that have been in the PICU. So throwback from the past. And then these were the spike, and it's really cool. Like if you go to the website, it has all the different respiratory viruses. They have a really cool way of like monitoring all of these. There was a spike in rhinovirus and enterovirus too. But this is really interesting to watch, like how RSV is coming back, especially in probably in those little babies who have not been exposed to RSV, or their moms have not been exposed. I think this is the end of my presentation, and I had Baby Dog asking you to all to get vaccinated and register for the lottery, right?
Yes.
Hey, Dr. Gupta, is the interpreter interpreting what Baby Dog is saying or what the governor is saying?
I don't think the puppy is saying anything. The puppy looks mad. Or is it the face? I don't know. I think that, I don't know, Dr. Weiss. I'm not the interpreter.
It does look like the same, like, you know what I mean?
Okay. And this is why I will not be invited to do a talk again, because people just crack jokes at the States and everything. Yeah, great.
You did wonderful, Dr. Gupta.
Really?
Thank you so much. Really, you did. I think it's really important. It's nice to have those updates and get to see the graphs. I'm a visual person. I think many of us are. So getting to really see that is important. And yeah, just continuing in this path, I think we do see a light, but there's also a lot of unknowns. So it's important to keep up with the data and what's going on. So really appreciate your time and putting that together at last minute. Thank you so much.
Great, thank you.
Thank you. Very informative. Okay, so does anybody have any questions, or we can open it up and discuss other kind of topics within COVID that you guys would like to discuss? That's what we're here for. So please don't be shy, chat in, use the raise hand feature as well. What are others recommending for the vaccine? Do you want to expand on that a little bit?
Yeah, so I think that the vaccine is still very safe. This is a very rare side effect. It's 1 in 50,000, 1.6 per million, right? So 1.6 per million. It's not 1 in 50,000. So it's very rare. Anyway, what are others recommending? Anybody worried, or are we still recommending? I'm recommending it, I'll tell you that.
We're still recommending, trying to get people in.
My children will need to grow up really fast, or the studies need to be done really quickly so they can get their flu shot, because they have been waiting forever. They are like, when can I go do this? When you have the vaccine. So yeah, they will get it as soon as it is approved. Yeah.
I think it's interesting. Yesterday's paper or today's paper, there was an announcement that all WVU athletic events will go to 100% capacity with the same kind of tailgating as there always has been, and so on. And you know, I think in the summertime, and you know, that's going to be just fine. And then it makes you think about as the winter, I mean, we're just getting into summer, but I mean, sports take place, you know, late fall, winter, and so on. So then people are going to be going more indoors, and what's that going to look like? Is that going to be is proclaiming that everything's going to be open? Well, I guess we don't need to get the vaccines, and so there's going to be less incentive to get them. I don't know. It's just kind of a interesting sociologic or political or whatever thing. You know, I went to my bank here in town this morning, and before I walked in, I looked at their door to see if it had the sign that says, if you've been fully vaccinated at least 2 weeks ago, you don't have to wear, it didn't say that. And so I went in and there was the plexiglass and everybody's wearing masks. And I said, oh, you guys don't have that. Like, no, everybody's masking full time. And, in the bank, which is not crowded, and you go to, Kroger's, Walmart, whatever, and it's a bit more crowded. Nobody's wearing masks. So I don't know. It'll be an interesting experiment.
Absolutely, 100% agree. It'll be really interesting to see how we go and with the different variants and how we're going to kind of implement those types of structure in our daily lives. You guys can hear me still, right? Okay, good. I'm just using the space bar instead right now because we have another question. Can you explain why in the cases of thrombosis with the J&J vaccine, you get thrombosis when the platelets are decreased? This also occurs in, correct me if I'm wrong, heparin-induced T, but I don't understand it either.
I think we need a hematologist on here to explain that. I'm not sure that I understand it. It's more of an adult phenomenon that occurs. The clotting, it's not the platelets that cause the clotting. I mean, there's other factors, there's other things that cause clotting, right?
Yeah, Kathy, we're just country pediatric infectious disease doctors. We're going to defer on all of these kind of things.
No worries. Thank you so much. Honesty is key. We do need someone that probably gets to understand a little deeper. I know it's not me, and I apologize.
So Shipra, I wonder if you know, or anyone on the call, Marty, if you know when we expect the FDA to give full authorization to the vaccines, because I hear rumblings that places will require vaccination when they're not under emergency use.
I heard fall that FDA was gonna provide a full approval, but then again, this is all rumors. I have not seen any official. But then there is ACIP meeting this week, which is gonna be cool to see what they are talking about. But those are long too. Dr. Weiss, you're not on service. Maybe you should attend it.
I have a question. Does anybody know if like different variants show different symptoms? Have they like discussed that at all? Besides like transmission being, I think, a lot stronger in like the Delta version.
So I have not seen official publication on this, but I have seen a lot of people, especially in India, they were not reporting loss of taste and smell. So I am very confident that my mom back home had it because she still was, the housemaid was sick, and then the housemaid came home and helped clean the house, and then she got sick. But so my mom has had both the vaccines. So maybe it was modulated because of that. But then there were other people that I've heard, like they had the cough, runny nose, fever, but they did not complain so much of loss of taste and smell, especially Indian people who eat really spicy food. Like they would really notice that really quickly. So I did not hear a lot, and I'm waiting for official documentation on that. But yeah, that was one thing that I heard.
Are there any other questions for today? We still have a bit of time. Let's see. Can places require proof of vaccination? And what do you say to people who say that it's HIPAA and they can't ask? Carmen, are you speaking? Sorry.
I may be talking to myself, but
Yeah, I do it too. It's fine.
you know, my opinion on that as far as HIPAA is that anyone can ask anything, but the individual isn't obligated to share that information.
This is Lisa. I don't know if you can hear me. I'm sorry. I'm traveling today, and I'm on in an area that's pretty loud. But I think this has been discussed at many different levels, particularly in regards to like proof for travel. We have a military team that's going to the Middle East next week, and obviously I'm not going to. Dr. Weiss is certainly, you know, more familiar with military, but even just the travel there, you know, these other countries required full proof of vaccination. And so I think in the United States, you know, in regards, this is where the whole concept of vaccine passports have come into play. I think this is going to be a little bit of a new charted territory. I mean, just from reading the history books, I mean, you know, we require proof of vaccination for other things. We require proof of vaccination for school. We require proof of vaccination for other areas there. And it's, you know, in regards to HIPAA, although it's personal health information, it also is, you know, for the public and those around you. So there are other scenarios in which we require proof of vaccination, and you know, there's obviously debates every year that go on if there should be compulsory immunizations. There's laws every year that are introduced in our own state legislature to address that. So I think in regards to you know, COVID-19 vaccine, you know, if it's a private business, they can require whatever they want. You know, if I go to a certain resort, I have to show proof that I'm going to be there to go in. So I think that, you know, the public places are going to be a little bit different. So I think time is going to tell, but certainly we're already seeing that. There's been many colleges and universities requiring, you know, requiring vaccination and then subsequent proof of that. And we've seen others have voluntary. So that's kind of my comments on that. So there is a little bit of precedent for it, even, you know, in our own state. Other than medical exemptions, we don't have non-medical exemptions in West Virginia. So if you go to a public school in West Virginia, you have to provide your proof of vaccination, and that's a requirement.
Actually, if you go to a public, private, or parochial school in the state, you have to prove you've had your vaccine. The only option for non-vaccinated is homeschooling.
Yeah, true point, Dr. Rexford.
Great, thank you so much. That was an excellent answer, and it helps. And I do think time will tell how they're going to approach that. I really appreciate that. Does anybody else have any comments to add to that before I go on to our next question? Okay, any suggestions on how to help people who are still worried about potential long-term effects of the vaccine, especially mRNA? How do you reassure people, and what's your line that you can use when you're addressing?
So again, sorry, it's getting loud where I am. Hopefully it will, you're able to hear me. But I think, you know, we've seen this question be at the top since the beginning of the pandemic for us. You know, long-term side effects consistently is one of the top questions that we see in our data. I think, you know, now, I mean, early on we would say, you know, these vaccines have been tested in clinical trials with thousands of participants. Now, you know, you can say that millions, I think we're even approaching the billions mark if you look, or we will be close to that from a worldwide perspective, but millions of people have received these vaccines. As a point of reference, it is 6 months to the day and almost to the minute that we administered our first vaccine in West Virginia. We did our first vaccine in West Virginia back in December, and you know, I think it's a credit of how fast time has flown. But I think when we're talking about long-term side effects, you can now say, you know, if the vaccines were tested in thousands of participants, and then millions of individuals have also now been vaccinated, and they've been safe, and you know, certainly have seen the reduction in deaths and hospitalizations, and I think it's those individuals. You know, it's been 6 months since I had vaccines, and you know, I'm still doing well, and so I think, you know, I think showing how many people have had it, and then asking if there's more specific questions they have.
Absolutely. I feel like that reassures, myself, and I forget who said it a while back, but with vaccines, usually you're going to see the strongest type of impacts or on your health in the beginning portion. Like, I forget who said this. It was one of our sessions, I believe, but they said it was like usually within that really initial time frame versus long term with most vaccines. So that reassures. I think that would be reassuring, and hearing the facts and like giving that type of number, I think would help individuals feel a little more at ease when it comes to the vaccine, and just paying attention to their symptoms if they have any in those beginning stages. But thank you so much for that answer. Does anybody else have any type of lines or things that they say to patients to make them feel a little more comfortable?
I tend to, a lot of patients, I tell them, I like Lisa, I was vaccinated in December. I was like, 6 months out, I'm still here. And that I feel like the benefits have been significant.
I just asked them to check for horns on my head to make sure it's been 6 months if the horns popped in, and then they're okay. But then they're like, that there's the spectrum of who are just like, no, it's a chip and I'm never gonna take it. I'm not gonna argue with there's a chip. Like, that is just silly. But if you have questions about the safety, yes, I would try and bring you to the middle of the spectrum, or move you towards more vaccine, understanding the safety of the vaccine from my standpoint. But then once I have a really hard time addressing the chip thing. I'm just like, why would we want to do that when we already have cell phones to track you all the time? Which is just me being me. Look, Lisa.
And I think, yeah, I typed in some comments that we have from a recent Ask the Expert series we're doing. And I think it's also important, because I was just on a webinar yesterday that, because we're seeing less COVID in general, we're sometimes a victim of our own success with vaccination. People think that the disease is gone. And so although we're still learning and we don't believe that there's any long-term consequences of COVID-19 vaccination, we know, and we have proof that there is long-term consequences from COVID-19 disease. And so we are still seeing that, and seeing individuals have long-term consequences from the actual disease itself. So I think that's important to highlight as well. Everyone wants to talk about the long-term effects of vaccination, which have really not been proven, but we know, and we have so many examples of the long-term consequences of individuals who had COVID and survived, but still have long-term impact from that disease.
Absolutely. Thank you so much. I would rather take the chance with the vaccine. It's not even taking a chance to me, but I'd rather do that than get the disease. I was fortunate to have not, I always had a negative test, but I'm super scared to go out during that time. So I was pretty much a hermit. Any other questions or comments? If not, you're going to get some time back to your day. I really appreciate all the interaction and discussion. But our next session will be July 1st. We will have more upcoming about that. And then we do have, I believe, the poll put on here. So before you go, please do partake in that. And I appreciate everyone's time.
Thank you.
Thanks, everyone.
Because I'm the co-host, I cannot finish my own poll.